My name is Liana Laughlin, and I know it's been a while, but I'm finally back. And for today's episode, we are going to talk about how to fix my nose bump. About a year ago, I got a combination treatment of nose threads, nose fillers, and nose Botox. And as you can see, the effects are still clearly here, but now is the perfect time to do some touch-ups to maintain the beauty of my nose. And for today, we are also getting into skincare. I just got back from the US not too long ago, and my skin has been having a hard time to cope with the weather and environment changes. I noticed some small bumps and some acne growing, but not to worry because Dr. Contessa will formulate the best skincare to ensure that I have smooth and baby skin. So stay tuned and don't forget to hit the subscribe button and the notification bell.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up from our former guest. Let's all welcome back Liana Laughlin.
Hi.
There you go. Well, Liana started when she was just 16 years old, a teenager, okay? And right now she's your 20. Okay. So, Liana had done, treatments with us. The first time was the face contouring, right? The narrowing of the face. And we were able to give a very good result on that one. And Liana was able to maintain a good slimmer face, a contoured face. And she looks matured right now to me because before she was just a baby and now she's really a lady. Okay, there you go. So for today's episode, we'll be doing like a repeat treatment of what we've done recently, like a year ago, right? The last one was nose enhancement, something to, give more projection or like a better looking nose. Because Liana she has a high nose. It's more of just making it aligned and also making the tip projected. Okay, for some people they have droopy or like a downturned nose, tip of the nose, like, because looking at Liana, the so-called nasolabial angle, ideally for women we need it to be like around 100 degrees or like 95 degrees. For Liana, it's like in a right angle thing, or somehow you're noticing it's a little bit droop, right, or like downturned. And then also we wanted to work on the sides of the nose and improve it, like make it narrower. How was it, Liana, so far? Like when we did that before, and then like what did you notice? Were there like further improvements when we did like a nose enhancement on you?
What I definitely notice is as time goes by, my nose looks better.
Right.
And you can't really pinpoint what it is, but it looks more beautiful than how
True.
it was before.
Exactly. You're right there. Because those who had done like non-surgical treatments, when we do like insertions of like this PDO threads, PCL threads, and somehow improve the shape of the nose, the profile of the nose, they were sharing with me that over time they're seeing a better shape, a better profile. And so meaning to say there's something there. Okay? Although the material that we are inserting, these are absorbable, but somehow they help in like the internal structures remodeling, restructuring, because we know these are products that stimulate collagen formation or any connective tissue formation, something like that. And especially Liana is so young. So for young ones, of course, they have very active cellular metabolism or the formation of new tissue matrix. So the younger you start, it seems like it's better because there's more of tissue regeneration for the young ones, right? It's an advantage, okay? So for today, it's been a year, right? Or more than a year. I can no longer remember when was that. Okay, we'll be doing something to re-enhance it again, to kind of maintain that projected tip of the nose. So we'll be doing some treatments there via non-surgical method again. That's somehow gonna improve the shape, improve the dimension of the nose. And in addition to that, because Liana also was asking me about skincare, what to use to prevent formation of pimples. Liana is 20, so she's still in the age whereby you still get these acne, these pimples. She just arrived from, when did you arrive from the US?
A couple weeks ago.
Yeah, so she's been traveling also, okay? Yeah. So sometimes you get stressed from traveling also. And when you get stressed, you're gonna see some pimple coming out. So I'm noticing also some, in the cheek region, cheek area, noticing some acne there. So what kind of treatment are we gonna suggest or recommend to Liana for her to have that pimple-free skin, or also targeting the skin pores? We wanted to also minimize the skin pores and make the skin always smooth, really clear, and baby skin. So what kind of treatment, what procedure are we going to do for Liana? We will show you when CSA Medical Aesthetics return. And we're back. So we'll be working on the nose for Liana. And I was doing an assessment, and I noticed the part of her bridge is kind of tilted towards the left side. So if you assess the radix here, so it's in the center, but when you go to the rhinion part and the supratip part, this area here, the cartilage here, is tilted towards the left side. So in cases like this, we can do a so-called alignment, so we can correct the defect on this right side of the bridge here, on the distal part here, together with the tip projection like that. Okay, Liana, you're good? So I'll be working on a portion of the bridge here, and before I do that, so of course we clean the area, we put topical numbing cream, and I still need to numb the entry point. When I do my numbing of the entry point, I pinch the tip here and a tiny needle injection there on the infratip region, a tiny needle, and our lidocaine. So this is kind of a little bit of of course the lidocaine injection has some a stinging sensation there. This is the local anesthesia for our nose treatment, okay? So after our local anesthesia, so we will make a tiny puncture on the entry point there, a minimal puncture there, and then I will still use my Restylane for Liana for me to be able to still correct that this crooked nose something. And I'll use a cannula here, gauge 25 cannula, and I'll just glide it onto the dorsum of the bridge. And of course there will be some resistance to this. Pull up the nose like this to look or feel for that space there where you can glide your cannula. When you do your filler for the nose, you have to be in the deepest anatomical layer. So this is gliding my cannula there, and just a minimal Restylane here. I'm just using a small amount of my Restylane there, but I am placing my filler mostly on the right side of the bridge where we have the deficiency there, because we noticed that the cartilage is skewed to the left side. Okay, just a little bit there, a minimal dose only. And then after that, we'll also be injecting a bit of my Restylane into the anterior nasal spine. So we want to have that upturned or rotation of the nasal tip and columella. I need to reach the so-called anterior nasal spine. Okay, so some patients will feel some discomfort because of the entrance of the cannula there, which is expected. There's a space here, the so-called intercrural space. That's the one where I need to place my Restylane. So I'm using a cannula here. So my technique here to really rotate the nasal tip upwards will be via this placement of my Restylane, high G prime Restylane on top of the anterior nasal spine. It's like an implant that you're gonna place there, like a minimal amount only, 0.2 to 0.3, just to project my columella or bring out the columella there. So we're done with that Restylane. Then I can still use a bit of my, for example, you can use your PDO or PCL threads to straighten like a nose that has a little bit of a tilting or like skewed to one side. We can place, for example, my PCL. Since Liana has a longer nose, I can use this PCL thread here. I prefer also PCL because it's longer lasting, plus it's a flexible type of suture thread. So as compared to the PDO and PLLA, those are like stiff kinds of threads. This one is flexible, so somehow less of a discomfort when it's inside the nose tissues. So this is to align, straighten the dorsum of the nose for Liana. So just 2 threads there and we're good already. Now if I want to correct my tip here, so I want it to tilt, actually I think I need a little bit of my Restylane more. So my Restylane will still further help me in projecting this tip here, nasal tip. And we have our cannula again there, and then we're gonna fill in further. Some cases, if they really have a flat nasal tip, I really use my filler to really give that very good projection there. But I placed it in the deepest part there, the base of the columella there, to be able to really upturn, especially for women, because women should have this upturned nasal tip here, or your columella should be showing, or it's obvious, because some have hidden columella, so we have to show that columella there. So I think I'm using like up to 0.4 for Liana here, and there you go. Now I'll be using my PDO threads for the tip, the short PDO thread, but whenever I do my tip columella projection, I make another entry point. So if you have a second entry point on the tip defining point of the nasal tip region, you can direct it perpendicularly to your anterior nasal spine. So the length of the threads here should be equal to the length of your columella. Make sure that you insert the entire thread for you to prevent the so-called thread extrusion or thread protrusion, because there are several cases now whereby the threads come out from the entry point, and there are other cases the threads come out on the inner or the nasal seal or the medial aspect of their columella there, the inner columella part, because when you insert the thread, make sure that it is within the intercrural space. So I need a 1938. So you have to choose the right length of PDO thread for the tip for you to achieve the correct result here. So for example, this one is a 38 millimeter length. Okay, the goal or the technique there is to pinch for your columella for you to feel that your thread is within that intercrural space. This will guide you in placing this thread into the columella, but you really have to insert the entire length of your cannula. So make sure that in your entry point, there's no visible thread there to prevent complications. So like in my practice, I use about 2 to 3 pieces of this, case-to-case basis up to 6, depending on the available space, available intercrural space. So for her, I'll be using just the 3. Okay. Now another technique that I do to really upturn this is to also inject a so-called Botox on the depressor nocicepti muscle here, so that it doesn't pull down your tip. It doesn't create that droopy nose. So we can use Botox for treatment of droopy nose. We use Botox for treatment of alar flaring to kind of relax the dilator muscles of your alars, and also a Botox for droopy nose to also relax the depressor muscle here. So we'll be injecting also Botox here and a Botox there. Some of my patients are asking if like they can we inject Botox on these sides of the alars. It depends. Some cases have, like for example, a gummy smile, we inject Botox here on the sides of the alars, just to relax the levator muscle so that it doesn't really show the gum all the time. So we do that too, okay? Now, I'll be also doing a so-called mesotox for Liana. What is mesotox? Short for mesotherapy, using our botulinum toxin. Her concern was the development of acne. You have some open pores here, right, Liana? Mm-hmm. And then we still wanted to reduce some of the oiliness because with her age, there are still oil production on the forehead, on the center of the face. These are areas rich with sebaceous glands, right? Even the chin area. What I'm gonna do is I just have very micro needles, okay? These are just a tiny needle, and we will be doing the so-called roller type. And then inside it, we have the botulinum toxin, okay? This is a hyper-diluted botulinum toxin, and we will be only reaching the so-called dermis layer to be able to deliver some of our or we call it baby dose of our botulinum toxin or microtoxin, to be able to tighten the skin pores or close the skin pores, to be able to reduce oil production from the sebaceous glands, and with that you can prevent already the acne formation, okay? And this will improve the texture of the skin, and we want a really smoother, finer, and tight skin for Liana, okay? So actually on the forehead, we can start a little bit, so disinfect the skin. And we are using a micro roller. So we call this mesotox. So she's just 20 and we can already start. So just a tiny like denting here like that first initially. How is it, Liana? Okay. So this is like just a very minute one, like even like 0.25 millimeter only. Actually, we're reaching only the epidermis-dermis layer. So we want to somehow reduce the sebum production and minimize the oiliness of the skin. You're still good, Liana? Okay. So, we had done mesotox treatment. We had done the nose projection. We'll show the result to Liana when CSA Medical Aesthetics return. And we're back. We'll be showing the result to Liana. Liana, you can look at the mirror now. Look at the nose and the skin. Look at that.
Perfect. You can really see the difference. It's like a straight line.
Exactly. Instant result. So a while ago, we were like talking about how the nose of Liana was skewed to the left side. And then like if you take a photo, you'll be noticing the reflection of light is not straight. And then after we have done like a little bit of a filler Restylane and my PCL straight threads, we notice the reflection of light is already straight in the center of the bridge of the nose. And then also the tip was projected. We were able to like rotate it upwards or like make the angle around 100 degrees angle. So it's not the right angle like that 90 degrees, but a little bit of like a 100 degrees like that. Okay, so for the tip projection. And then we have also injected some of our botulinum toxin in the depressor muscle and the dilator alar muscles there to still narrow the sides of the nose and to maintain that upturned nasal tip to prevent droopy nose tip. Okay, so your botulinum toxin can be used for treatment also of droopy nose tip. That's an additional information. And then mesotox to close the pores, reduce your oiliness or the sebaceous gland production, and also some skin tightening there, which is the collagen production. So all those rejuvenation effect for the skin to give you that finer, smoother, younger looking skin. Right, Liana?
Yeah.
So exciting. So happy for you. Okay.
I really love it.
Okay. Do you have any like message to our televiewers?
Well, I think that one important thing for an attractive face is having a symmetrical face.
Correct.
And I think this made my face perfect. So
Yeah, thank
go
you.
ahead and try it out.
Right, there you go. Because beauty is balanced, beauty is symmetrical. Everything should be within the right proportions. That's a good point, Liana. Okay, so for those people who have these concerns also, okay, so the non-surgical nose lifting is not just for those with flat or not so high nose like me, okay? So it's also for those individuals. You already have high nose, but you notice there's irregularity or it's skewed, it's crooked, asymmetrical. We can do some non-surgical methods to correct those deficiencies or those imperfections, okay? So for Liana, okay, we still have to maintain her skincare. We still have to prevent acne formation. Actually, I have given a prescription for Liana skincare, like anti-acne medications, topical medications, and she has to maintain with that. Of course, you're still in the age whereby there's, active sebum production, your oil glands are still active, and you have an active lifestyle, healthy lifestyle. So we just advise you to maintain proper skincare plus CSA treatments, because we'll still combine her treatments with some of our thulium fractional laser or LASEM-D, and also combine with some of our skin booster maintenance, and of course, like always, meeting with Dr. Contessa to see what's happening already. It's right that you still maintain your follow up with your dermatologist, your aesthetic doctor, aesthetic physician, or skin specialist, for them to really have that completion of your management. Because in our treatment, it's not like, for example, you have pimple today. It's not like forever you don't have a pimple. Of course, we have to do some maintenance skincare also there. Thank you so much, Liana.
Thank you as well.
Okay.
I really love it.
So you're growing with CSA.
Yeah.
And we're happy to have you with us all the time. Okay. So for those who have questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Now, if you want to see the other episodes, other videos where we highlighted treatment for Liana, you can just check our YouTube channel, Contessa Salvador. And please do subscribe and also click that notification bell and the like button there. Any social media they can reach you, Liana, or follow you? Instagram?
You can follow me on Instagram at LaughlinLiana.
And
yeah,
that's it.
it.
Okay. So thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.